Why are we, the healthcare professional, struggle with our own healthcare? Hi, my name is John. I have been working in the healthcare industry for more than 10 years. I have worked on the clinical side as an EMT, trauma hospital, and then psychiatric hospital before I transitioned over into the administration side. And during this past 10 years, I noticed that we as a healthcare professional are not good at take care of ourselves, even though we should know better. We should know that, hey, Nate, what we should eat, what should we do to take care of ourselves, both mentally and physically. But as a healthcare professional, we struggle with taking care of our own health. So let's talk about it. The irony, when I was working as an EMT, being fit and being shaped is a part of my job because I had to lift the gurney and also the patient on the gurney into the ambulance. So I have to be physically fit to carry at least around 200 pounds or lift 200 pounds with my partner to carry the patient to the gurney, to the ambulance, and from the ambulance to the ER bedside. So being fit is part of my job. But after I switched job to work in a trauma hospital and a psychiatric hospital, my weight is very much yo-yo, and then eventually I became overweight. And I noticed that a lot of my coworker and people in the healthcare industry also struggle with maintaining a healthy lifestyle. Why we struggle as a healthcare provider. So first, the stressful environment. As a healthcare professional, especially on the clinical side, and so we had to work in a stressful environment. Usually, if you're in the ER or very much the trauma side of the hospital, you are pretty much always on the go, and sometimes the situation could be very stressful, and also most hospitals nowadays are understaffed. So sometimes, from personal experience, I have seen nurse in the ER having like 3 patients had to take care at the same time, and things could be very stressful, and most time they will go over their lunch hour. Why we struggle? First, let's talk about the high stress environment. Personally, from my experience working in the ER and from the ambulance side as a EMT, I have worked 10, 12, 24, and 40-hour shift, and sometimes we just don't sleep. Because of that, if you notice that a lot of EMT, paramedic, fire department at nighttime, they are very cranky because imagine working without sleep. I think now in California, there's more regulation that makes sure that we at least have some downtime to rest. But back in the day, you could pretty much could go on 24 hours without sleeping, on call, transport patient back and forth throughout LA. And we pretty much just down coffee, energy drink to make sure that like, we are awake and alert. And again, it's ambulance and emergency situation. So there's a lot of adrenaline pumping in our system, and it just it can be really bad, and that's why a lot of people burn out after a few years and transition into the hospital or into the management role to avoid burnout. And personally for me, I have seen that nurses and pretty much people who work in the hospital also have a lot of demanding hours. I think around, let's say, nurses who work in the ER or on any floor, mess floor, could be like work 12 hours a day. If you're lucky, you could work 7 a.m. to 7 p.m. But if you work night shift, it's at 7 p.m. to 7 a.m. And that is kind of messed up your sleeping pattern. So high demanding job with high stressful environment and lack of sleep will cause your body, it's not good for your body. Irregular schedule for eating and drinking. With eating and drinking, most of the time, as I mentioned previously, most time you pretty much work around 12-hour shift. So let's say 7 a.m. to 7 p.m. Technically, you do have a break in between for your snack and lunch. But let's say you're in the ER and you have a busy day with accident, all that stuff. You pretty much gonna be focused on patient, and sometimes you're just gonna have like 2 or 3 patients that you're taking care of. And let's say they are in critical condition, you might forego your break or your eating and drinking to pretty much like replenish yourself. You should focus on the patient first, and eventually that time will get pushed back to later. So let's say you have at 5 hours, you gotta have your lunch, but that 5 hour could turn to 6 hour. And so we don't really have a set schedule for eating and for break and lunch. Technically, in California, there's a law that, hey, you need to go take your break, you need to go your lunch, but sometimes things happen. You can't just like drop your patient and then, hey, I'm gonna go take my lunch. Most of the hospital nowadays, they are more aware of the situation, so they will have a nurse or someone to take over your shift to cover for you to take a break and rest for the next 30 minutes to an hour, so you could recover and continue on your shift afterward. But back in the day, like 10 years ago, it's a totally different ball game and a different thing. So that's why like you could see that a lot of people who work in the healthcare field, their eating habit is kind of all over the place. Sometimes by the end of the day, we just want to have something, a comfort food. It's like, personally for me, I like cheeseburger and pizza. It's not something healthy, but it's a long work day, and by the end of it, we just want something good to eat and comfort ourselves. Caregiver fatigue. By the end of the day, we are so tired of taking care of everyone, our patient, that we just forget to take care of ourselves. And I think as the time go on, we just want to get home, maybe have a quick meal, shower, maybe watch some TV, or just relax. Because imagine this, you work 7 a.m. to 7 p.m. So by the time you get home, maybe 8 o'clock. 8 o'clock, let's say you only have like 2 or 3 hours. That's already 10 to 11 p.m. Go to sleep. You have to wake around 6 to go to work at 7. So you don't have that much hour in between, especially if you work as a nurse. That's 12-hour shift. Let's say you work any other hours. Let's say you work as a regular clinician or any healthcare professional, 8-hour shift, right? Either way, by the time you get home, you just don't want to do anything. You pretty much just want to relax. And sometimes going home, you just want to do things that's technically not healthy, like eat out, eat comfort food, maybe drink some beer, some alcohol, and just watch TV. And technically, we as a healthcare professional know better. We should go to the gym either in the morning or after work. But personally for me, as someone who have worked like long shift, by the time I get home, I'm tired. I don't want to go to the gym and work out. So this year, I will change and I will try to get at least 30 minutes of workout after I get home. That's why I bought dumbbell now. But it's tough. Trust me, it's tough because by the time you get home, you're tired. And I totally understand. If you're a healthcare worker, I totally understand your struggle. Working long hour shift, by the time you get home, especially if you have family, kids to take care of. Imagine you're taking care of your patient. Then when you get home, you have to take care of your family, your kids. You don't have that much time to take care of yourself. So it's 2025. It's a new year. The reason why I'm making this video because I want to share my experience and talk about why we as a healthcare professional struggle with our health. Whether you are in clinical or you on the administration side, we struggle with our health because it's healthcare. It's a demanding job and it can be very stressful. And during stressful situation, I'm an emotional eater. Like I eat when I stress. And that is not a good habit to have, especially when you get older. So for this year, I want to change pretty much my lifestyle. I want to be more mindful about my eating habit, my snacking habit. So this year, last year I also did intermittent fasting, but I kind of quit halfway. So this year, I want to stick with it and be consistent with my intermittent fasting, and I'll make sure I'll be more aware of my macros and calories. On the exercising wise, by the time I get home, I will try to do 20 to 30 minutes of workout with my dumbbell. I know because I realize that the longer I wait when I get home, the lazier I get. So right now, my go-to way to make sure I work out and exercise is I work out before I go to work or right after I get back from home. That's the only way for me to work out, because knowing myself, by the time I'm done with work, I was just tired and I just exhausted and I just want to be lazy. So that's my goal for this year. Be self-aware, and that's why I'm making this video, to keep myself accountable. And if you're watching this video and you are a healthcare provider, healthcare professional, please comment down below and let me know what is your struggle working as a healthcare worker provider, and what is your way to overcome it and be like better, improve your health both mentally and physically with a demanding healthcare job. Let me know down in the comment. And I will see you again on next video. And if you have any interest topic to talk about, let me know so I will make a video about them in the next video. Alright, take care of yourself and really take care of yourself. And I will see you again on the next video. Bye. Take care.